Therapy can be a scary word for most people. You have to put your thoughts, feelings, and emotions out in the open to be seen and assessed. But therapy can be very helpful for those struggling with psychological disorders or those who just feel the need for emotional growth. The therapy techniques we will be discussing today fall under the category of psychotherapy, treatment involving psychological techniques which consist of interactions between a trained therapist and someone seeking to address psychological difficulties or achieve personal growth. The first one is psychoanalysis, which was developed by Sigmund Freud. He believed that the patient's free associations, resistances, and dreams, and the analysis interpretations of them, released previously repressed feelings, allowing the patient to gain self-insight. The goals of psychoanalysis are to bring up repressed feelings and reclaim unconscious thoughts and feelings. A technique used in psychoanalysis is free association. In this technique, the patient gets comfortable by lying down on a sofa or couch with the analyst or therapist sitting out of sight. The patient then talks about whatever is on their mind. This could be childhood memories, daily routines, or dreams that they had. The analyst listens to the thoughts that they have and for any resistance that they might have to certain memories. The analyst then uses interpretation to help the patient understand their unconscious mind. Our next therapy technique is person-centered therapy, which is a form of humanistic therapy. It was developed by Carl Rogers, in which the client directs the discussion and the therapist uses techniques such as active listening with an accepting, genuine, empathetic environment to facilitate clients' growth. Active listening is defined as empathetic listening, in which the listener echoes, restates, and seeks clarification. Another type of psychotherapy is behavior therapy. This is defined as therapy that uses principles to reduce unwanted behaviors and increase desirable behaviors. A type of behavior therapy is classical conditioning. Classical conditioning has subcategories, two of which are exposure therapy and aversive conditioning. Exposure therapy is defined as behavioral techniques that treat anxieties by exposing people to the things they fear and avoid. Aversive conditioning is associating an unpleasant state with an unwanted behavior. The last type of psychotherapy we will cover today is cognitive therapy. Cognitive therapy teaches people new, more adaptive ways of thinking, and it is based on the assumption that thoughts intervene between events or emotional actions. Cognitive therapy was developed by Aaron Beck and is more effective with clients who suffer from depressive disorders or anxiety-related disorders. Overall, psychological therapies are used by many different therapists all over the world and are designed to help clients with their psychological disorders or their need for personal growth. While different methods work for different situations and disorders, everyone can benefit from psychological therapy.